Hello, I'm Michael Hainsworth. It's said that growing old is mandatory, but growing up is optional. But when it comes to Canada's finances, the country is maturing in more ways than one. With a shrinking workforce, revenue growth slowing while costs for healthcare, pensions, and seniors' benefits escalate, this issue disproportionately affects the provinces, which bear the brunt of healthcare spending. In the recent CD Howe Institute commentary, Another Day Older and Deeper in Debt, we learn that over the next 4 decades, governments face an implicit $2 trillion liability due to these demographic changes. Meet Bill Robson and Parisa Mahboubi, the co-authors of the report. They warn that while immigration can partially offset workforce shrinkage, it's not enough to reverse the aging trend. As a result, both tax revenues and public services are strained, particularly in provinces with slower population growth. So what are the solutions? Bill and Parisa, join us now. Thank you for joining us.
Pleasure, Michael.
Thank you for having us.
Bill, why isn't it simply a function of increasing the transfer payments to the provinces?
You jumped right to something that the provincial premiers certainly glom onto at their regular annual conference. I'm sure that there will be increases in federal transfers to the provinces in future. It's a very difficult dynamic for the feds to resist. But when you look at the consequences of past increases in federal transfers to the provinces, it's almost, it might buy you a little time in terms of the provincial budgets, but in many respects, I would argue it even sets us back. Because the changes that we need to make in order to spread this burden more fairly, get better value for money in healthcare and other services, really are things that the provinces need to do on their own. You talked about growing older. You're also supposed to get wiser as you grow older. And I'm afraid that on this file, we may not be quite as wise about the mistakes of the past and ready to try things that might be a little harder to sell in a sense, but likelier to be effective than we were in the past.
Parisa, your thoughts?
My thoughts are the same as Bill. It's really important to make sure that, for example, in terms of the spending that we model in the study, because they are age sensitive and they are mostly delivered by provinces. So it's really important to distinguish between the role of federal government and provincial governments.
One thing, Michael, I might just say that one of the things that's a little troubling about the fiscal imbalance, because as you allude to, our projections show the federal government is in much better shape than the provinces, and it's mainly because of healthcare, where the provinces are the ones actually delivering the services. One of the things that is troubling about this situation is that the federal government, we've seen it lately, very expansive fiscal policy. They're not really feeling the constraints. They're seemingly feeling, and there's now a bill in front of Parliament that would make this worse, that you can expand payments to seniors. They're only indexed to inflation. They're not actually indexed to economic growth. If there's productivity growth, they get more affordable over time. We have reports from the chief actuary showing that the seniors' benefits rise but then fall off. Well, that's true if they don't change the program. But lately, they seem to be following this populist bent of increasing payments to seniors. So not only does the recipe for more federal transfers fly in the face of experience that says if you don't really hold the province's feet to the fire, if you just give them more money, then the quality of the services doesn't necessarily increase, although the cost of them certainly does. But it also sets up this feeling of, oh, well, the feds are fine, so therefore it'd be okay if they increased their exposure to demographic change. When you look at the national picture, we're very exposed. So it'd be nice for the federal government not to give in to those temptations as well.
Well, then, Parisa, let's pick up on that. Given the provinces face a greater fiscal challenge than their federal counterparts, what specific strategies can the provinces adopt to manage these rising costs without relying too heavily on federal transfers?
Sure, absolutely. Basically, there are two broad ways to be able to tackle the challenges. It could be, focusing on revenue side by increasing, for example, the tax base, consumption tax base, and also in terms of productivity, increasing productivity, encouraging greater labor force participation, providing training to make every worker more productive. It could be also it could be just also a responsibility of federal government to think about the enhancing productivity, but provinces also can be involved. In regards to expenditure and spending side also, provinces should consider doing things that reduce the cost of delivering, for example, healthcare, which is a major spending in the future. So how to do that? By, for example, delivering services in a more efficient way. And City Howe Institute's publications have already discussed, ways to be able to do that. For example, revising the scope of practice, and to be able to getting healthcare services and care through, for example, pharmacies and nurse practitioners rather than just doctors, that they are more expensive. And also in terms of, for example, providing care to senior individuals. If, for example, the type of institution, it's really important to be able to identify the type of institutions needed to support seniors. And there are better ways and less expensive ways to deal with that. And Canada is not in a good position when it comes to comparing what we are doing to other countries.
Yeah, go ahead.
Back up, Bill. I heard consumption tax in there. We already have the GST, the HST. I can imagine folks in Alberta none too keen on the idea of having a tax in the first place, and the rest of us none too keen on seeing it go up.
No, that is certainly true. I'm going to, Michael, challenge your editing skills by putting something in that you may find a good follow-up to what Parisa just said, and then I'll address the point that you just raised. With respect to treatment of seniors, it's clearly front and center as a challenge when you're looking at demography and fiscal pressures. Quick shout out to our colleague Rosalie Wanch, who's done work in this area. It really is true that when you look across different jurisdictions, you see quite markedly different things. And hands up every aging Canadian whose ambition is to spend the last 5 years of life in long-term care and the last 5 days of life in an intensive care unit, right? Like, nobody puts their hand up for that. But in Canada, you're actually a lot likelier to finish your days that way than you are in other countries. So it's expensive and it's not what people want. So there really are some important alternatives that we could be looking at to provide better care cheaper. People often say, you got to choose between the two. Not in this case. You could have better care for older people at less cost. On the subject of consumption taxes, they are very difficult to raise, especially in our current climate, where people kind of have a bit of a living for today attitude.
Some have no choice, particularly with the inflation we've been seeing.
Well, and also the tone of fiscal policy lately. I mean, governments can lead in this area, and lately governments have not been leading in a way that would really encourage people to look beyond tomorrow. But when you do look beyond tomorrow, and of course this study is encouraging us to look well beyond tomorrow, there are a number of things that are attractive about consumption taxes as opposed to the alternative. If you're going to have to raise the revenue somehow, what's the best way to raise it? Well, in an older population, fewer people will be working. So personal income taxes might not be as robust a base. Sadly, with lower labor force participation, you also may not have as vibrant a business sector, and Canada's been struggling in that area. So do you want to have higher corporate profit taxes? Well, a lot of people say yes because it looks like somebody else is paying for it, but corporation taxes come out of individuals, workers, investors, just like all taxes do. Why are consumption taxes more attractive? Well, partly it's because the base is more robust as people get older. They keep spending as they're running down their savings. So that's a tax base that's likelier to hold up well. And also, and it's the economist lesson that the politicians don't want to hear, but we're saying it again, it's a less distorting tax. If you're trying to get your economy to grow more quickly, if you're trying to fight those headwinds of demographic change, you want to be levying taxes that are going to be less harmful to growth. And consumption taxes, they may be unpalatable the way they hit you in the face, but it's the best way to raise a dollar for these services in the future without constraining the growth that we're going to need so badly.
I don't know if that will prevent the pitchforks and the torches at 67 Yonge Street, but let's talk about another way in which we can improve that revenue stream: immigration. crucial factor in slowing the demographic shift towards an older population. But your report stresses that you can't completely reverse the trend of an aging population, especially given that immigrants themselves will age over time. So since immigration alone can't solve the aging issue, what other measures could be implemented to sustain a workforce growth and economic productivity?
So when it comes to immigration, first of all, one thing that we need to highlight that is to increase labor force participation. Immigration can help, and also, but at the same time, it is really important to increase the labor force participation of existing population, and also encourage older workers to delay their retirement. So the longer they stay in the labor market, even past research that I did with Bill, shows that it's more impactful, when we are looking at mitigating the impact of aging populations. We need immigration, there is no doubt, but immigrants age as well. So increasing labor force participation, at the same time also ensuring that immigrants can contribute more to the labor market, that would be beneficial. For example, immigrants, there are gaps in the labor market in terms of the participation, in terms of, for example, employment rate, and also in terms of earnings gaps between immigrants and non-immigrants. Improving these gaps and closing these gaps can also help Canada to mitigate some of the impact of fiscal pressures in the future.
Immigrants are younger than the existing population, but not so much younger that it makes an appreciable difference. I mean, we did a study a while ago that looked at, it was a little bit of a stretch, but to say, suppose you're focusing on that ratio of seniors to working age people, what kind of immigration numbers would you need to stabilize it? And they're like an order of magnitude higher than what we've seen lately. And what we've seen lately has clearly created a lot of stresses in the housing market and elsewhere. So it helps. But if anybody who says, well, that's the thing that we need to do, and therefore we don't need to do anything else, among other things, you're going to create a sort of economic and fiscal situation where immigrants aren't even going to want to come. So you have to do other things as well. Immigration helps, but it's not the answer by itself.
So as the workforce grows more slowly and economic activity and tax revenue also slows, we get that reduced government income. So the provinces with, say, the most subdued workforce growth, you point out Newfoundland and Labrador as an example, they're expected to face the steepest challenges. What are the potential consequences for provinces with particularly slow revenue growth if they are unable to adequately adjust their fiscal strategies?
So in terms of the impact, there is no doubt that they have to finance the increase in expensive. So increasing the tax rate is something that could be one way to address that. But our estimates shows that, for example, Newfoundland, they need to increase their taxes by 2/3. The residents wouldn't take that easily, and it would be very challenging for the province to increase taxes to that specific rate. But other policies that we mentioned in our papers should be considered by all provinces, including those that they are facing significant challenges.
One thing that's also kind of interesting, because we've just been emphasizing that for the country as a whole, immigration is not really the answer. But when you're looking at individual provinces, there's a bit more room to influence your future for better or for worse, ideally for better. And the example I'd raised from the past, some people may recall that there was a time when Saskatchewan looked like it was a chronic population loser. Their fiscal situation looked pretty bleak as you projected that out. And then they turned it around after decades of losing people just about year in, year out. Saskatchewan became a population gainer, and now they're one of the provinces that stands out as being in the best situation. I'm not suggesting it's easy for a province such as Newfoundland and Labrador, but they really, I think, do need to think, among other things, about what it is that's in an increasingly mobile world, in a world where people increasingly are able to work in one place and live in another place. Can you do things that would make it more attractive to stay in Newfoundland and Labrador, stay in the Atlantic provinces, because they're the ones that are facing a lot of this pressure? Again, as with immigration, not the only answer, But if I'm a premier, if I'm a finance minister, if I live in one of the Atlantic region provinces, that's one of the things I'd be saying is, why are we having this population problem? What about the growth polls in Newfoundland and Labrador? If you've been to St. John's, a lot's happening in St. John's. It attracts people. Halifax, Dartmouth. I mean, you have those growth polls there. So it's as with the country as a whole, it's not the whole answer. But for the provinces, when you look at the size of the flows, it looms a little larger as a potential way of helping your situation. And who doesn't want to attract population? I mean, if I'm throwing a party, I want people to come.
I'd like to add something. We do have right now some programs that targets specific regions, for example, Atlantic regions, to attract immigrants. But one thing that these provinces need to focus on, maybe they are attracting, but they also need to make sure that they're returning those immigrants, because immigrants can move across provinces easily. There is no restrictions after they get admitted to Canada. So one thing that these provinces need to make sure, not only in terms of attracting, but also returning those immigrants.
I wonder what role education plays in that. And Bill, you pointed out Saskatchewan sort of turned things around. We know that province found religion on high tech. But your paper also expresses concern that education spending is expected to decrease as a percentage of GDP because of the slower growth in the student age population. Family benefits also projected to decline relative to GDP as those benefits, are tied to inflation rather than income growth. The aging population is expected to shift its focus and spending away from these areas towards senior services, making the decline that much more inevitable. How do we balance generational equity? How do we ensure that the people we're bringing in, whether they be from other provinces or from other countries, get the education they need to help build that base for a 21st century economy?
We don't emphasize this very much in the paper, but you can make similar arguments with respect to education that we've just been making with regard to healthcare, that you can get better quality without spending a lot more money, or maybe even spending a bit less money. Again, this is not a topic in this paper particularly, but when you look across Canadian provinces, you look at their scores on national achievement tests for students in elementary and secondary school. When you look at the OECD studies on student achievement across jurisdictions, the correlation with money spent is extremely loose. There are lots of jurisdictions that have larger class sizes, more direct instruction, and very good educational outcomes for students. So part of the challenge is to deliver better education, make sure that students are coming out of school, going on to tertiary education, coming out of that, if they pursue it, ready for the labor market, ready to lead fulfilling lives. And when you look at some recent results in Canada, particularly on the OECD's test that we just in Ontario had some indication that students are increasingly failing to meet the provincial standard. I mean, there's no excuse for that. It doesn't cost more money to give students a better education. It's a matter of curriculum and delivery in the classroom. So that's all very devoutly to be wished. In terms of, I'll just jump off in a slightly different direction because, Michael, I think there was a bit of a tone or a sort of an invitation in the beginning of your sentence to say, where are our priorities going to be? It's difficult when there are fewer younger people, when there are fewer families with children, to keep that focus on education and to prevent the political dynamic of saying more benefits for seniors, as the Bloc is now proposing. We should have federally, and as the Liberals have recently done, more money for healthcare, which of course is a constant pressure that we're all aware of. It's going to be a challenge, and one of the things that I think is troubling is that there was a little bit of awareness that this was going to happen when you go back a few years. And if you go back to the 1990s, when the federal government had its big fiscal consolidation, there was concern about the Canada Pension Plan running out of money. And they actually took steps to pre-fund it, to bring some more money in the short run in order to be able to keep the increases in payroll taxes contained in the future. Very forward-looking, very helpful for intergenerational equity. We haven't been thinking in those terms. COVID really set us back. It'd be nice if Canadians could reorient their thinking a little further out, yeah, more money in education is good. More intergenerational fairness is really quite essential. It's quite irresponsible to be thinking only in terms of what can I have today and not making provision for the future.
Help me understand that pre-funding, because you point out that this was something that we saw in the 90s with the Canada Pension Plan that could help distribute the financial burden more fairly across the generations. But where's that money going to come from if we're saving money for a rainy economic day?
Well, it has to come from our current incomes, and with people pinched the way they are right now, it's a tough time to make that pitch. But we're going to be pinched in the future as well. And the thing that was quite refreshing about the 1990s was that there was this awareness that if you didn't pay now, you were going to pay more later, or somebody else, like maybe your kids' generation, was going to pay more later. So what they did was they set some money aside, and now the Canada Pension Plan Investment Board, along with the Quebec Pension Plan, has built up a very nice kitty. And that money is paying investment returns that are helping to pay the benefits, and therefore it looks as though it's stabilized, and we're going to pay the same contribution rates now that we do now well into the future. There are areas that you could do that in other than that pension plan. For example, long-term care. A lot of us are going to need it. It's quite predictable. Why not have a small levy now that would help to pay for that in the future? Similarly with seniors' drug plans. Again, the correlation with age is strong. Older people tend to be more treatable with drugs that are very desirable to have. So since it's predictable, make some provision now. And in the long run, you'll be very glad you did, because you can kind of stabilize the cost of those programs.
If someone read the commentary, Another Day Older and Deeper in Debt, Parisa, what would you want that one key thing that they would take away from that report to be?
So the most important thing is that when we are talking about population aging population, we are not talking about just the number of people and the growth in the number of seniors. It's all about the longer impact of demographic shifts on our economy, on public finances and healthcare system. So it's really important to consider that and to plan for what's going to be ahead of us.
We're worried about the government debts we know about, as we should be. But there are other debts out there, other promises that governments have made that we have not been thinking about how to pay for. Healthcare at the top of the list, and it's time to start thinking about that too.
Bill, Parisa, thank you so much for your time and insight.
Thank you.
Thank you.
Bill Robson is the CEO of the C.D. Howe Institute. Parisa Mahboubi is a senior policy analyst at the Institute. Read the commentary titled Another Day Older and Deeper in Debt at cdhowe.org. I'm Michael Hainsworth. Thanks for joining us.
You've been listening to the C.D. Howe Institute podcast with Michael Hainsworth. Subscribe on iTunes, Google Play, and Spotify. The C.D. Howe Institute is an independent, not-for-profit research institute whose mission is to raise living standards by fostering economically sound public policies. The Institute is widely considered to be Canada's most influential think tank and a trusted source of essential policy intelligence, distinguished by nonpartisan, evidence-based research and subject to definitive expert review. Visit cdhowe.org and follow us on Twitter and LinkedIn. Thank you.